So my name is Bob Glatz, ENT doctor. I guess my mom was an attorney, my dad was a doctor. I knew I didn't want to be an attorney, and sort of really probably since I was like 5, I always wanted to be a doctor. Would play in the yard and pretend I was a doctor, all that kind of funny stuff. And so made it through college at Wake Forest, medical school at Wake Forest, residency at Southern Illinois University in Springfield, Illinois, a fellowship at Johns Hopkins in pediatric ear, nose, and throat, and then down here to the Rio Grande Valley. So been here since 2005, really love it. It's a great place. I don't do a lot of cancer surgery, but I do a lot of really intense ear surgeries, cochlear implants, bone-anchored hearing aids, ear reconstructions, bad mastoid disease. I like doing sinus disease. That's also kind of a challenge. It's another sort of challenging area of our field. I do pediatric airway, so kids that have breathing difficulties, which most of the ENT doctors don't like to do that because the kids are sick, and it's kind of a challenge. And really feel like I help a lot of people out, especially with this new balloon sinuplasty technique that's out. It's really one of those things that's sort of an untapped group of people that really haven't responded to traditional medical therapy, and so it's really been a great opportunity to be able to, instead of giving somebody another prescription for a medicine that's not going to work great, offering them the balloon sinuplasty and the ability to make the problem go away is, really pretty cool. I think one of the things that makes me sort of maybe different than the other guys is that I really do, when I'm taking care of my patients, I really think about what would I want if I were in their shoes. I really try to make a decision that's kind of right for the patient. It's also important to keep in mind their personal problems, any other surgeries that they've had, their other medical conditions, and kind of look at them, saying, all right, if this was my mom or if this was my kid, what decision would I make for them? And I really try to make those decisions. So, and I think that for me, that helps me a lot too. It helps me get good results because I'm making sure I'm picking my patients appropriately. I do good work, and I follow through and make sure that things, go well.